Time now for Health Matters. I'm here with Lynn Szabo, PA at Redwood Urgent Care, and Lynn ordinarily has notes for these. Today you've got 2 pages.
I know, there's a lot to talk about. This is a look at gun violence as a public health issue.
Now this is everybody looks at gun violence all the time in all sorts of ways, but you seldom see it addressed as a matter of healthcare.
Yeah, there's a reason, and we'll kind of get to that because It's actually, as far as the CDC goes, it's not allowed, which one wonders why. But I want to start with definitions. So the first is the epidemiology. So epidemiology is the study that identifies risk factors, causes, and outcomes of health problems. Okay, so gun violence is definitely a health problem, and we'll address that more in the statistics as we get into it. But this is a way of looking at a data-driven kind of evaluation to see how we can address this in a way that makes sense. From a scientific viewpoint, but also makes sense for community safety and reducing mortality and morbidity. So another little term there, morbidity means disability secondary to gun. And so not necessarily, disability like somebody gets put on disability, but disability like somebody might have PTSD from even witnessing a shooting.
Okay,
like
lingering effects that aren't mortality
that
issues.
affect our community because somebody is maybe a little less than they could have been. So public health is pro-health. It's not anti-gun. Okay, that's really important to keep in mind. And this approach is more like injury prevention and a proactive, community-oriented, and this overrides the kind of good guy, bad guy way that we look at guns so often. Okay.
Well, now you're saying if you look at guns and gun violence as a health issue, as a personal or as a public safety, a public health issue, then you're taking away all the moral overlays that we put on this whole thing about good guy, bad guy, constitutional rights, things like this. No, here's a mass of people, here's a mass of guns, here's how many people are hurt.
Right, and we should recognize that guns are actually involved in how we see ourselves, because we got idealized, fighting against the wilderness pioneer version of ourselves with, the faithful musket or Smith & Wesson by the side to, kind of, I guess, cultivate this great country of ours and tame the resources. So
one thing, I've done a lot of work in the past in photo restoration and talking with my father about old-time photos and history and things. And cool. It's very cool, actually. And I've learned a lot of local history just through fixing people's old pictures. But one thing that I learned in that was that those Old West pictures where you've got Butch Cassidy or whatever, some famous somebody, and they're sitting there, even a famous nobody, they're sitting there and they all have their gun.
Right.
It's because their gun was their most prized possession. It's not about a threat. It's not anything. No, this is what this does everything for me, and I put everything into this. It was a big part of their world.
Yeah. This kind of helps. This is my most important tool in my struggle against, I guess, the wilderness. Okay. But we got some problems here. Okay, we got a lot of problems.
Fast forward.
Yeah. We have increased crime and violence, but our rates of increased crime and violence are consistent with a lot of other countries in the world. But our amount of lethal violence is way out of line. If you look at the numbers, way out of line compared to other countries, even other countries with the same kind of crime and violence problems. So this is kind of an older piece of data, but I found it interesting. If you look at the number of accidental gun deaths, this is accidental, okay? In the 5 high gun ownership states compared to the 5 lowest gun ownership states. Now this comes back from around Y2K, so 1999 to 2000. It's 5 times higher the amount of accidental gun deaths in the 5 high gun ownership states compared to the 5 low gun ownership states. So there's something about guns that on every level that make gun deaths, I guess, more likely.
Okay, as I read that, it's 10 times higher.
Oh.
The numbers?
Yeah, okay. Well, one reference I saw was 5 and one was 10, but you're right. The numbers actually are 5 high gun states have 2,200 in 1 year, 22 accidental gun deaths, but the 5 low gun states, 207. You're right, that's 10 times. Wow. So the effects of firearm trauma include psychological problems like PTSD, physical mortality and morbidity, medical costs, and social costs, and we all pay for that. Not only the individual, but we pay a lot for the medical costs to get people whole again. So hoping here also to remember again that gun ownership isn't the same kind of situation as smoking. So some people have tried to kind of equate gun ownership with smoking and the social pressures to stop smoking, so a social pressure to stop gun ownership. But that's not going to work here because gun violence isn't the same thing as gun ownership. And we have to be really clear about that. So we got some problems.
No, I see what you're saying with that, in that the hazards of smoking are part and parcel of possessing cigarettes, right? Unless if you don't use them, then you're not a smoker. But if you're a smoker and you use them, and using them, that's when you hurt yourself. That's when you hurt other people around you. Whereas a gun can be a tool, it can be not touched and not used, but it's not. The danger isn't inherent in gun as it is in a cigarette. Am I reading that right? Am I saying
true.
Okay.
Because you can, I suppose you could use guns for entertainment. Let's say you want to go out and shoot at tin cans down by the dump or something. That's not necessarily inherently dangerous. Okay, I suppose if you use lead bullets, maybe. But we're not looking at that problem here today. So here's the problem with studying gun violence. The Dickey Amendment of 1996 was set into a spending bill mandate, and this makes the Center of Disease Control not able to advocate or promote gun control. So they can't do any studies at all. So in that...
Why can't they do any studies at all? Is because a study would have some sort of end?
Because then you have to have a conclusion, and there's, I guess there's a fear that it's going to promote gun control, and whoever Mr. Dickey was, he didn't want that to happen in 1996. So they redirected all the money to the study of traumatic brain injury, which is probably helpful because I imagine there were a lot of soldiers coming home from the wars, and that traumatic brain injury was probably an important injury that needed to be studied. But and maybe some people felt like that was an indirect way of looking at gun violence, but it's not direct enough so that we can draw any conclusions from it. Executive orders were later signed by President Obama, but no funding was allocated. So there's no CDC-related study as to looking at guns specifically as a public health risk since 1996.
So now, why is that an issue? What sorts of things does the CDC track now?
So interesting, one thing that relates directly to that is the CDC put out in the last couple of years a study on suicide. And one of the major causes of suicide, especially in men, is gun as a mechanism to kill themselves. And we can't even look at that. It's not even in that study. It doesn't even say that guns were the biggest cause of suicide. It says it indirectly.
So are there analogous things the CDC can look at and offer opinions about that are analogous to the gun reports that they can't
they kind of dance around it, but they don't directly say that this is a result of guns, of use of guns, or availability of guns.
Are there other things out there in our society that they do say that about?
Oh yeah. About as far as relating to public health, let's use the suicide thing as kind of a model. Yeah, they talk about suicide from, for example, how many people died of suicide in a certain year by taking pills, or how many people died of suicide because they threw themselves in front of the train, or any of the other horrible ways that somebody could off themselves, but they don't really say, even though it's the number one cause of suicide, they never really directly say that it's guns.
Wow, okay.
So you can say that, look, this person overtook their opioids, or this person threw themselves in front of the subway train, but not that they took a gun and shot themselves. Although that's the most common method of suicide, especially in men. So, and it's kind of interesting too, is the men are likely, if they want to kill themselves, are likely to use, if they're a handgun owner, they're likely to use handguns to do that, but they're also not likely to try and kill themselves with other methods of lethality, okay? And so what that one of the studies I read, that the people that wrote the study suggested that if you have the means to do it, it's kind of a in the moment
Yeah.
kind of activity. And if it wasn't available, or if there was like a lock on it, or if there was, if it was put away by somebody else in the family trying to protect that family member, then maybe that person would not choose to kill themselves. Yeah. So the other thing too about not having any good studies about gun violence is really the best study. This is the nature of science itself. The best study would be a longitudinal study. So that means a study over a long period of time where you could study a community that had, let's say, no restrictions on guns, and then all of a sudden one day, bingo, there was a restriction on guns, and then you could compare that group of people kind of pre-gun restriction and post-gun restriction and see how it goes. But that's not really possible. So you can't really put people on an island and control it like that. It's not ethical, and it's not really logistical, not logistically possible.
I think the closest thing that I've seen are the numbers about assault weapon
Right, when the
use.
assault weapon ban, yeah. Right, but that's still...
It's not scientific. It's just
Yeah.
almost anecdotal or statistical.
Right. Yeah, and you could probably draw some statistical conclusions, but really, science is a weird little thing sometimes, and it really demands kind of rigorous parameters, and you can't really put those on a group of people, not like this. So it's also really, really hard to tell that if somebody, if there was gun violence that resulted in suicide, whether it was actually suicide, whether it was accidental, or whether somebody was actually murdered. So a lot of it is just kind of shrouded in mystery and not really easily understood, which is kind of sad. The other thing I found really interesting, I was listening to something on NPR the other day, and they were having kind of a conversation between somebody who was representing the viewpoint of the NRA and then somebody who was opposed to that. And the number of the person who was opposed said the number of mass shootings, and I'm just guessing here, I'll just fill in, it was X, and which was a lot higher than what the guy representing the NRA was saying was the number of mass shootings. And then, so it became apparent that they were defining mass shootings in really, really different ways. Most definitions of mass shootings are 4 or more people killed, not including the person who was the perpetrator. And by that definition, then the shootings that happened in Gilroy, that doesn't qualify as a mass shooting, although I think anybody would look at that situation, or certainly the families of the people that were lost or hurt in that situation, look at it as a mass shooting. Some other definitions of mass shooting are you have to have greater than 5 people wounded, not including the perpetrator. And so when people are talking, I think, on these type of discussions like on the radio, they're really, the differing definitions really make it hard to tell exactly what they're talking about, because the person talking about common sense gun control was saying, look, we have, this is what's going on. We have, I think it was 237 episodes that this has happened, and the guy representing the NRA said, no, there's only 11 mass shootings in the time period you're talking about. So clearly they're defining it differently, and I think it makes it even that more confusing. But
How would you define a mass shooting?
I think the standard definition is 4 or more people murdered, but I guess in my mother's heart it would be, the loss of one person, I think, is too much. So, I mean, in which case I suppose you could have a mass shooting as a result of a domestic violence dispute. And I don't know, to me that seems like an unimaginable loss for the people involved.
Yeah. But I mean, at the same time, I mean, just as with you talk about your mother's heart and the
Right.
CDC, things like this, you got to look at these things scientifically too, if you want to make any sort of.
That's our whole point, isn't it? So I think 4 is the most scientifically acceptable.
I don't think it's a numbers thing. I think it's an intention thing. I think there's a big difference between, and this is such and I'm ashamed on a certain level that we're even having a conversation like this.
A
But
life is a life.
Exactly. And,
Yeah.
and we have to put it in this kind of, I don't know, hermetically sealed scientific sort of definition so that we can make informed decisions about it. It's tragic. But there's a difference to me between, say, a crime of passion in which somebody has a point, has a motive, and acts on that motive. and specifically against somebody else, and somebody who just goes in and doesn't know anybody and just opens fire. There's a big difference. But I mean, I'm not saying that one's better or worse. I'm just saying definition wise,
Right.
so that domestic violence, that person where it's a very specific set of people involved in this,
Right.
and specific sets of motivations dependent upon those people.
Right.
That's not a mass shooting. That's a murder.
Right.
Mass shootings are also murder, but you don't have a
But they're kind
connection
of
between.
even more horrific. Then
Yeah.
I think looking at it that way. Then we should look at the number of people wounded, and not wounded, not necessarily wounded and survived, but wounded and survived, and wounded and perished.
the bystanders. Sort
Right,
of thing. Yeah,
right. Because I think that gives a better idea of the carnage, I guess, and not counting the shooter, because sometimes I think some of those are suicidal attempts too. I don't
death by
think they
police.
expect to get out of it,
Yeah,
alive. So
Yeah, and it's again, it's a gruesome, horrible thing to be talking about too.
Yes, totally.
Yeah.
yeah, especially because the Gilroy one, not a mass shooting by common definition, but
But
two beautiful children and another young man killed. I'm sure their families deeply miss them. So grim statistics. I just threw a bunch of them together because they were kind of horrible. So in 2017, firearm-related mortality in the U.S. was 39,773 dead.
Do you have any sense, looking at these, if that what the trajectory of that is over time? Is that up, down,
Increasing.
steady state? Increasing?
It was increasing. It was definitely increasing. More males are killed than females by a factor of a little over 6. Black males certainly die more than white males, but Hispanic males die less often than black and white males.
Really?
Yeah, I find
Interesting.
that interesting. Now, see, it would be nice if the CDC could study that.
And find out why.
Yeah,
What's
why
driving
is that?
Yeah.
I mean, I have a curiosity about that. You might not be saying that Hispanic males die less. You might just be saying black males and white males die more.
Yeah.
Yeah.
Mhm.
So I don't know. I think that deserves some evaluation. So firearm-related deaths are in the top 5 leading causes of mortality in U.S. citizens between the age of 1 and 64. So that makes it a public health crisis, in my opinion.
Wow. So,
So-
that's up there with heart disease. That's
Right.
up there with what?
Smoking
What else? Is
mortality,
Yeah.
probably.
Wow.
Yeah. Yeah, pretty horrible, and especially in kind of, that's a broad age range, age 1, specifically said 1. So age 1 to age 64.
I'll be darned.
Yeah, that's a lot of people.
And again, any other nation any other developed nation, Western nation that is anywhere near that?
No. Even nations like, you've probably seen statistics comparing the United States to Japan, because there's a thought that violent video games are. Apparently the Japanese spend more money and time looking at violent video games, both men and women there,
Yeah.
and that their amount of death by gun violence is like,
It's like in the dozens.
yeah,
Right?
it's minuscule compared to what we have.
Yeah, and then on top of that, then too, you've got just the number of, like we've discussed this before, Canada has a much higher gun ownership rate
Right.
and a much lower death by.
Right, you kind of mentioned that about Del Norte when we were kind of talking about doing this show, is that your intuitive feeling was that Del Norte probably had more guns than I think we were comparing to Humboldt County, but Humboldt County has more gun violence. That was our intuitive guess. So I thought that was really interesting.
And again, those aren't numbers that we can go and find someplace, right?
No, because we're not allowed to study it. That's crazy.
Wow.
So let's see. Oh, here's a scary thing. Excuse me. Most gun deaths are suicide, but the mass casualty shootings, there's like a learning curve. And so some of the shooters study previous shootings and develop more deadly ways of carrying things out.
Oh my God.
That's horrific.
That is horrific.
So not only, I guess, more efficient killing machines as far as their guns, but more ammunition, more strategy as far as working their way through a crowd.
Tactics and such.
More
Wow.
paying attention to where people might hide or how people might hide. I know in my kids' school, when my kids were in high school, they were told during the shooter drills to turn off their phones, or at least turn off the sound on the phones and the lights on their phones, because some of the shooters are looking for stuff like that. Pretty horrific. And I did read on the internet, I don't know if this is data driven, but a kid refused to get tennis shoes with lights
Right, I saw that too.
because they felt like that made him a target. That's really sad. But Let's see. I'm going to drop down to the number of mass shootings in the United States, having tripled since 2011.
Whoa.
Tripled. So you asked in the beginning of the number of people
How
that
was
died with firearm-related mortality. At least mass shootings have tripled. And it costs us. So in 2010, gun violence cost U.S. taxpayers $516 million in direct hospital costs. So, even though we don't know these people, I don't know these people who were shot in Gilroy, but my taxes are helping to pay for their care. And of course, I'm not begrudging them that, but I think we have to look at that in a public health view. And we can't right now because
Okay,
of the
so-
1996 laws.
Given everything you said about the CDC, how do you, where'd you get that next one?
Yeah, I know. That's it's claimed on the average one child died every 3 days in accidental shootings in the U.S. from 2000 to 2005. I don't know if that's an indirect. The CDC does make some comments about gun violence, but in a very indirect way. And I'm wondering if that just kind of showed up on a. I think that showed up on just a graph without any comment. But that's a pretty horrific statistic. Died every 3 days in accidental shootings. Now, that's not necessarily somebody goes out and shoots somebody. That's, a little kid playing with a gun maybe, or somebody in a hunting accident. Really sad, though. That's a lot of our children being wounded or actually dying. So this is the conceptual leap. What can this little data tell us? So this is kind of under the header common sense gun restriction, I think. So I have seen a lot of data that kind of suggests that the public supports banning automatic weapons, or at least banning high capacity magazines. And I think that makes some people nervous. I think most of the there are a really small number of people in the United States who own really large numbers of guns, and I think that's a hard place for them to go to, but I think this is a really common sense thing. I think the Second Amendment, I think the intent was to have a well-controlled, is that the word, controlled militia? I don't think it's controlled, but well-run militia. I don't think random guy in his mom's basement with 100 machine guns is necessarily that. So, but that's my own personal opinion.
Sorry, I'm stuck trying to remember the Constitution. It's
Regulated?
I want to say regulated. I don't think it's regulated either. Oh, see, look at us. Here we are talking about guns, and we can't even quote the Second Amendment.
I know. Oh, God. Well, it kind of tells what side we're on.
Yeah, exactly.
But I think a lot of people in the public are kind of coming around with so many horrific shootings, and not only the ones that we see like Parkland and El Paso and Gilroy and Dayton, and I could go on, but also what happens in Chicago on any particular day.
That is what gets. I mean, first off, that weekend, the three shootings that weekend was horrific, and you could feel it everywhere you went. But yeah, that same weekend, I saw something pointed out online that there were more people killed in Chicago than died in all these mass shootings just from gun violence.
And the disparity of who's dying, people of color. So, I mean, does somebody really need to have a bunch of machine guns? I mean, I don't know. I don't.
Conversely, though,
Yeah.
do we need to spend our time arguing about machine guns? Could this be a straw man sort of thing? I mean, from the numbers, it's handguns that kill most people.
That's true. That's true. I think it depends on whether you're looking at, the Saturday night teens that are gunned down in Chicago versus, what happened in El Paso or what happened in the Pulse. I mean, that was a pretty deadly shooting.
Yeah.
That guy hunted people.
Yeah.
Yeah. So, yeah, that's a good point. Actually, handguns cause most of the deaths, but AK-47s are so much more efficient.
True, but it's also I gotta voice this. I'm a card carrier. I actually, in my wallet, I've got an ACLU card.
Okay.
I think that maybe it could be argued that us becoming so upset about mass shootings is just part and parcel of the racism in America and classism in
completely.
America, and that we
Completely.
lose sight of the real mass majority of people out there who are dying.
Right. The Parkland students have addressed that. We talked just before we started recording that I have seen that in the last couple of days they put out a platform kind of along the lines of the Green New Deal, kind of like their proposal for do something, the answer to do something. And they were actually been really careful in all of their activism to not only address the horrific thing that happened in their mostly white, upper class high school shooting, but also what was happening in Chicago. And I think if you looked at the March for Our Lives, you could see that a lot of their speakers were of color, and they were talking about their experiences, in their communities. So I think that's actually a really broad, recognizing the problems for all communities there. I think they're trying to address that.
Good.
Yeah,
Good.
so that was exciting about that. I think there is support for red flag laws to deny guns to the dangerously mentally ill or people with a history of domestic violence. We do know that history of domestic violence ties in a lot in when they're seeing all these mass shootings. A lot of these young men, unfortunately, have had that in their past, and some of them have actually probably had run-ins with the law, and sometimes it's not reported. And it might not be that they're perpetrators of the violence, but it might have been around them, perhaps as children. So that I think to look at somebody's past history of domestic violence as a perpetrator would be a really good thing as far as the red flag. I think that's data-driven to get people that are most likely at risk of, going through with these kind of horrific mass shootings. But there should be also a way to ensure due process, because I don't think we ought to just snatch up everybody's gun. I don't think that's the answer here. Not only is there a lot of resistance to that, but I'm not sure that it would actually be a solution. Like, as you say, handguns are a big deal. So while you're, preventing people from getting, high volumes of ammunition and high volumes of AK-47s, then you're totally ignoring really what's driving it. That's why we need this data. That's why the CDC shouldn't be a missing element here. Yeah. The other thing is there should be access to mental health services, and I think that would help a lot in this. There's been waning amounts of money, and it's pretty apparent in Del Norte, also in Humboldt County, that there really isn't the mental health services that we need to reach out to somebody who's in that kind of pain, that feels like they're capable of doing that kind of damage to the community. And I think it's unfortunate that we don't have more here for people. It's really almost criminal.
Yeah, and kind of pervades our society, our community here, and that
Right.
you can see that absence in mental health in the community and mental health services in just about any direction you look. It's not just
Right.
about violence. It's not just
Right.
about arrest records. It's about youth
Right.
in school. It's about coping. It's about
Right.
it's just this dearth you can feel.
Yeah, it's about reaching out when somebody's in trouble. But this is not to say that somebody who's mentally ill is inherently violent.
No,
I
not
mean,
at
they have a
all.
lot more violence. That we do have that data. They have a lot more violence directed to them than directed out. But you could say if somebody kills somebody, are they inherently mentally ill? You might argue that. I don't know. I don't think that's a diagnosable diagnosis code. But
Yeah.
but you could argue it. Somebody's got some torment there if they, in that moment, take a gun and go after somebody. So who are the allies here? Well, you know what? In the absence of the CDC, I think medical providers need to, stand up. For a while, we were, during well child checks, we were asking about if there were guns in the household and how they were stored and things like that. And then I think there was a lawsuit that prohibited doctors from even asking that, although I would argue that's a Second Amendment or First Amendment right. But I don't know really of any healthcare providers here that ask those questions, although I know some in the past who have in Humboldt County. And I think the numbers I saw for Humboldt County were 75% of households have guns.
Wow.
And so as a mom, with my kids, spending overnights with their friends, I would always ask what the gun situation in the house was, and it was a lot. So they spent a lot of time having overnights at our house with their friends because we didn't have guns in our house. So, but I think especially pediatricians or people who are working with kid populations should be asking these questions and making sure at the very least that there's some knowledge about how to properly store weapons, how to put kid locks on and stuff like that. So mental health professionals are important. We could certainly use more of them here. But and I think we also need more money for screening and intervention. It almost always comes down to more money. But you can't really justify money unless you have data. So we're back around to why isn't the Center for Disease Control allowed to look at this as the public health problem that it is. And my hope is that sometime in the near future we'll be able to change that. And I think if we do, that's the single most important response to do something. So the crowd that was, I guess it was the mayor of Dayton, Ohio?
I think so.
Was giving a speech, and the crowd was chanting one anguished voice first, do something, and then they started chanting it. I think that would be a really, really good place to start. Let the CDC do their job.
Yeah.
Okay.
For us.
Right.
Yeah.
Yeah. So those are my thoughts on that today.
Wow.
It's a hard topic.
It is a hard topic, and it was while we were in the midst of it there, I had this weird sort of dichotomy pop into my head, and we've talked about the cost and access, cost of healthcare and access to healthcare, and in previous health matters, how healthcare currently is a privilege and should be a right. It seems like guns currently are a right that maybe should be more of a privilege.
Yeah. I totally, well said. Well said. Very succinct. I agree. I think in the time that the Constitution was written and the Bill of Rights was written, maybe that made sense, but I'm not sure. I'm not sure we're the noble pioneers anymore with the trusty musket.
I'm 95% certain it's well regulated.
Yes, well regulated.
I think so.
Okay, we got it.
Okay, good.
So the dude in the basement with all the guns, not so well regulated. No matter what he thinks.
Yeah, interesting. A well-regulated. Well, very good. That changes the whole thing. Then you could argue gun control falls right in line with the Second Amendment.
Is an attempt to regulate it, but I don't think people like that word in association with it.
No.
So.
Well, Lynn, anything else? Anything you want to leave us? You got a joke or something to leave us with here? So we can
This was an intense, I did a lot of research on this, and it feels like there was a lot of loose ends still, and we could probably even talk about this another time. But I am kind of happy to be in a community that, although we're guessing that gun ownership is probably a little bit higher, that gun violence doesn't seem to be as high. But I do want to say, don't bring your weapon to Redwood Urgent Care. Please don't.
Do you have to say that?
Have
you had to address that?
Yeah, we have actually. So there's a lot of people in the community that wear concealed weapons. I used to see about one every 10 years. Now I saw two in the same day.
Yeah,
not too
it's
long
a more
ago.
common thing. Yeah.
This is a safe place. It needs to be kept safe. There needs to be no weapons. I don't know if you leave it in the car. I don't really know what you do with a gun if it's not on your person, but don't bring it to the clinic. Right. Don't bring it to any of the clinics. Don't bring it to the ER. Don't bring it to the hospital. So there you go.
Wow. Again, so much of this was startling and eye-opening, and right there at the end, it was still even startling and eye-opening. My gosh, that we have to say that.
I know.
All right, Lynn Szabo.
Yeah.
Thank you very much for today's Health Matters, and we'll get back into it next week. Thanks a lot.
All right. Bye-bye.